a journalist currently. I mostly cover science and health, and that started about 2 years ago. And before that, I was pretty active. So, I mean, I love the outdoors. I love climbing and skiing, and now I'm more into like health and science journalism. Something that makes me really happy is I love music. I love going to shows, and yeah, that's something that brings me a lot of happiness. And I think also just traveling. I think traveling is a really important part of my life, and yeah, it makes me very happy.
How have you been able to continue practicing your passions while also living with long COVID?
Yeah, so I think part of that is I'm trying to figure that out currently. I mean, obviously, I'm not fully able to be in the outdoor community anymore, which is something I had to learn how to navigate. Um, I am able to go to concerts, which I wasn't able to for a long time, and I've been adding that back into my life, which has been an extraordinary gift. Um, and then with journalism, I'm figuring out how to do that again, which is also a lot of happiness back in life. Um, the things that require or the activities that require, a healthier body and someone that doesn't have fatigue, I'm not really able to do anymore, which has been a tough thing to navigate, but I'm learning how to do other things instead, so that's been fun.
Can you describe the long COVID symptoms you still experience and which symptoms have disappeared or reappeared over days, weeks, or months?
Yeah, so I think the most profound symptom that I have that really impacts just my life and has since I've developed the condition is just the fatigue. And I would describe that as just my body constantly feels very heavy, um, and obviously fluctuates. So if I do, normal activity, like if I go out and I go to the grocery store, I go on a walk, it worsens and then I have to rest. Um, Kind of just feels like my muscles hurt a lot of the time. I feel achy a lot of the time. And then, I mean, I get fairly frequent, intense migraines from not doing a whole lot. And that's definitely worsened being in grad school because I'm looking at screens a lot of the time. I have to wear special like blue light glasses when I'm doing schoolwork because it just blocks the light essentially. And then I would say the other thing that really has bothered me a lot is, I have POTS or postural orthostatic tachycardia syndrome. So my heart rate isn't really able to regulate properly. And so there are some times where my heart will just start to race and there's nothing I can really do about it, which has been frustrating. But yeah, I think the most profound symptom has been the fatigue, and it has gotten a little bit better. I've also, I'm on a off-label medication, called low dose naltrexone or LDN, which has really helped. It's just increased my functionality, which I'm really grateful for because not everyone responds well to it, and I happen to respond well to it, and so that's really helped. That's really helped a lot of my symptoms. But yeah, I was reinfected with COVID in May, and it did bring a lot of my symptoms that were not present kind of back to the forefront of my mind, and they've been worsened again, which is frustrating. But I'm navigating it, and I'm doing better than I was, so I'm grateful for that.
Now, when you enter the long COVID clinic at Oregon Hospital, Census University, you said that the healthcare team asked whether you had undergone a tilt table test. How does this test relate to identifying conditions that overlap with or complicate long COVID diagnoses, such as POS, dysautonomia, MS, or ALS?
Yeah, so that test is used to diagnose POTS or dysautonomia, and it's interesting. I spoke to a researcher a few days ago who I asked her to define long COVID, and she basically said that it's a condition you can develop, or you can develop other conditions from getting COVID. And I thought that was very intriguing because I was like, oh, I've had both of those things, where I've developed long COVID and other conditions not associated with COVID. And so um, I guess I would say that I hadn't had that test done and I'd asked for it. And then when I got into the clinic, they were kind of surprised that I hadn't had it done. And so that was kind of navigating okay, so I should have had this done and I didn't have it done. And then of course they were like, yeah, you meet the criteria for POTS. And I was like, okay, yes, I already knew that. But sorry, I don't know if that answers your question or not.
Mhm. And also, you mentioned on the Disrupt for Diagnosis podcast that you use speech therapy. What symptoms related to speech, language, voice, or swallowing led to that therapy?
So that was mostly for just the cognitive difficulties I was having or the brain fog. That's a pretty standard protocol that they do. And I live in New York now. And when I got into the NYU long COVID clinic here, one of the first things they did was they wanted me to do like a cognition test. And then they wanted to refer me to again, like a speech test, a speech person, which just kind of helps with, if you're in a conversation and one thing with long COVID is you can have word loss, you can have trouble tracking a conversation. And so it's just, a therapist kind of helping you figure out how to navigate a conversation if you're having a symptom like that. If you can't remember what you were going to say or you're kind of lost in the conversation, it's helped to navigate that.
Did it also affect your voice?
Um, thankfully, no. I haven't had any issues with that. It's mostly just been with, you know, being cognitive and focusing and not getting lost in or tracking a conversation. I've definitely had difficulties with that since getting COVID. And so that really helped with that. And I mean, a lot of it was like she gave me exercises where, okay, I'm going to tell you a story and you have to recall three facts from the story. And so it was learning how to kind of do that and retain information.
The first person to suspect you had long COVID, even before you saw medical professionals, was your mother, who is also a nurse. How was she able to identify this possibility without formal testing?
Um, because she's very, very smart. No, I mean, yeah, she's brilliant, but I think, she had someone in her life when she was in her 20s who was very close to her, who developed a, kind of post-viral fatigue. Essentially, she got a virus and then she was, had basically fatigue for like, I don't remember how long it was. And so when I first got sick when I was 22, I was living alone and I was just tired all the time. And I would tell her, I said, Mom, I'm so tired. And she kind of recognized that it wasn't standard fatigue. It was something different and that I didn't sound like myself with the activity that I was doing, how I was just not it. And I kept telling her, I'm like, I just feel like since I've gotten COVID, I feel different physically. And so she'd been reading about, and then, long COVID was coming out in the media. There were more reports of it coming out, and my mom follows the news very closely. And so she was like, I think she immediately sent me an article and said, I think that you have this. And I was kind of like, that, there's no way. There's no way that I have that. But yeah, so she suspected it. And yeah, and none of the other doctors did. It was pretty funny.
Have you ever participated in clinical trial involving immunomodulatory treatments such as stem cell therapy? Because people with long COVID, their immune system is compromised. So have you ever been clinical trial?
Yeah, so I was in a clinical trial testing Paxlovid, which is an antiviral medication that they give to people who have a hard time with COVID. So I took that for a few months, and some people they feel better when they're on it. I did not have that experience. It actually made my symptoms worse, which is why I think that LDN worked for me because I think my symptoms are rooted in inflammation and my immune system is over responding. I don't think it's viral persistence in my body. Which is some people when they take Paxlovid, they have viral persistence, and so the medication can tamper that down and help them feel better, from what I've read. So I was involved in that clinical trial, but I haven't been involved in any others. I just haven't had time, and it's also just it's a lot. I had to go to the hospital, fairly often, do blood draws, which it's fun, but it's a bit depressing to do that all the time. So I have to do constantly, be getting tests done. So
You're committed to bridging the gap between science and the public. How do you stay informed about long COVID through your mother's medical background, through your own research or reading, or by engaging with others who share similar experiences?
So how am I bridging the gap? Is that what you asked?
Yes. Because I find you
Yeah.
very intellectual and knowledgeable about the medical or the healthcare sector. So who's able to facilitate you with this wealth of knowledge?
Well, I think, a lot of it, I spent probably 2.5 years not working because I was so sick. But I wasn't so sick that I couldn't read or I couldn't, go to doctor's appointments every once in a while. And so when you're that sick and you have nothing else to do with your time, you spend a lot of time trying to figure out how to get better. And so I just read a lot. I read a lot of books and I spent a lot of time going over, press releases and clinical trial results and trying to figure out what was going on with my body. And also, the gaslighting I endured from the medical community. When you're that sick and you were someone that was extremely active, to go from being extremely active to not being able to leave the house some days because you feel so sick, it's maddening. And you want to do everything that you can to get better. And when people aren't listening to you, you're trying to, for me, it was about collecting evidence that, I was sick. And so, yeah, I had to gain a lot of knowledge. And, when I was in that clinical trial, I realized that there were a lot of other people going through this. And when I started writing about it for Long COVID Connections on Medium, which is a writing platform, every story that I posted or published, I would just get floods of comments from people who had chronic conditions who couldn't write or didn't have a voice. And they would just say, please keep writing, please keep doing this. And I just kind of feel like I have a moral obligation to keep doing it because so many people are still sick. And, I'm working on a story right now about how long COVID clinics around the country are shutting down. And I'm talking to a lot of people that are more sick than I am who, again, don't have the ability to report and write the way that I do. And so I just feel like when you go through something really terrible like that, you have an obligation to be honest and to help people. And that's kind of what I've been trying to do. And I hope to continue to do it.
As a science and health journalist, what do you aim to report with evidence, empathy, and focus on improving public understanding of the US healthcare system?
Yes. And, I've read a lot of science and health reporting from various outlets in the US. And I mean, it's all very good. It's all based on evidence, but I think there is a big portion that's missing from the reporting. It's just the sense of understanding what people are going through and being very sensitive to that. And I mean, I've read a lot of articles about, long COVID or chronic fatigue syndrome or, these super rare diseases. And it's just very clear that there's questions that because the reporter doesn't have hasn't gone through something health related, they're not asking additional questions that would make the story just a little bit more empathetic and personal. And so I've been trying to do that but also remaining non-biased as a journalist, which is tricky. But I've been doing that fairly well, I think. So I've been trying to do that, and then I mean, also just the U.S. The U.S. healthcare system is not the greatest, and I've been trying to also cover that, and that's something that's been coming up a lot when I've been talking to long COVID patients. Is just that our clinics shutting down because of funding, because people aren't making money with long COVID patients because the treatment, there's no treatment for it. So it's definitely very rocky, but that's the reason to report on it. And of course, everything that I'm writing about, it has to be evidence-based. That's the number one thing with journalism. And it's also just important to me morally as a person that I'm not just, it has to be rooted in something.
What are some common misconceptions or false claims you frequently hear about COVID vaccines?
I think that, they don't work, that I mean, a lot whenever I really try to avoid social media because I think there's a lot of misinformation. It's very volatile right now. But when people, I know a lot of people around the country with chronic conditions, especially myalgic encephalomyelitis or long COVID. And when they share something, there's always a few people that go, oh, this is just like vaccine injury. And it's just, in a lot of cases, like, it's just not helpful. And I mean, I do know people that have had side effects from the vaccine. It's very rare, but that has happened and they've developed fatigue from it or they've developed long COVID like symptoms with it. So that is a real thing. But vaccines are safe and effective and they've saved millions of lives. They're backed by science. And, I mean, right now we're living in a very scary time where there's a lot of misinformation about vaccines, and that's leading to resurgence of vaccine preventable diseases and conditions, which is frightening. So that's what I'll say about that.
Can you describe briefly the difference between long COVID and chronic fatigue syndrome, myalgic encephalomyelitis? Are they all the same, but different names for long COVID?
Yes. So They're different. I don't know enough to really comment on it, but I've talked to a lot of people that have myalgic encephalomyelitis, or chronic fatigue syndrome, which that is the same. That's the same condition. It's just two different names. And I think most people that have it prefer to have it be called myalgic encephalomyelitis because like chronic fatigue syndrome just sounds kind of like it makes it sound like it's a lazy disease, which it's not. It's horrible. But from what I've been told by researchers, long COVID and ME, which is the shorthand name for myalgic encephalomyelitis, they're different, and they don't know what causes ME. From what I've heard, it can be, a viral infection, and then someone develops this disease, or it's from what some people have said, it's a trauma or it's just the immune system switches on. I don't know enough about it to really comment on it. But they're definitely different. But from what I'm seeing along, they have very similar symptom overlap in some cases. Um, yeah. So, but I don't know enough, unfortunately.
You're a member of the Association of Healthcare Journalists. What responsibilities do you have as part of this organization? And are you involved in any initiatives, especially or specifically focused on long COVID?
So I am not overly involved with with HCJ right now, unfortunately, because I'm just super busy with grad school. Um, I did work with a journalist who was really involved with them for a long time, and I haven't been able to be as involved as I wanted to. But they do really exceptional work. They have great webinars that educate journalists on how to cover healthcare, how to cover vaccines right now, um, and just how to cover like law within healthcare, which is a whole other facet. So but yeah, I wish I was more involved with them right now. But yeah, great organization for sure.
After navigating such a complex medical journey, what qualities define a good doctor for you?
Oh wow. I it's very, very hard to be a healthcare professional. And I think it's really easy when you have a chronic health issue to get very angry with doctors, especially when you've had very bad doctors who don't have a lot of empathy, but they are doing the best that they can. And I've had some very exceptional ones. So I think for me, a good doctor is someone who listens, who's open to feedback and genuinely wants to help you and has empathy. Um, I had a primary care physician in Oregon who I started working with about a year before I moved here, before I moved to New York. And um, so I'd seen so many doctors before her that I was kind of just very detached when I saw her because I was like, I don't know. I have to put up a certain facade when I see healthcare professionals just because of stuff that I've been through. And I was telling her about, my diagnosis and how I was feeling. And I remember she was typing at the computer and she stopped and she turned around and looked at me and she goes, "Are you okay?" I said, "What do you mean?" She goes, "I just can't imagine the grief that you must be feeling." And I had never had a doctor kind of acknowledge that what I had gone through might be hard for me because of how I'd been treated. It was always just they treated me like I was a robot or like I could pull myself out of this condition when I can't. It's not in my control. And if it was, I would have I wouldn't have gone through it. But she just treated me like I was intelligent and like I wasn't, overreacting to my symptoms and, being dramatic. And that was really helpful. And then she was also open to working with me. And I know a lot of people with long COVID who some of them bring their providers, stories or clinical trial findings and say, "Hey, this medication worked for these people. Would you be willing to prescribe this to me? Because I will literally do anything to feel better." And to me, that's a sign of a good provider is they're open to hearing that and they're open to learning from their patient, which I think for some doctors, they're not willing to do that.
And can you also share one of the most touch stories, one of your family members was your brother who passed away because of leukemia and how he motivated you to become a science and healthcare journalist?
Yeah. So, I mean, I think, he's always inspired me to just live every day and to not take things, I don't want to say too seriously, but just not get worked up about stuff because, like, in the end, we're just trying to live life. And I think people, especially in this field, can get very rigid and very intense about things and kind of make situations very like life or death. And at the end of the day, like we're all just doing our best and that's all we can do. And so, I'm doing this work because I enjoy it and I care about it. And if there's a day when I no longer have that feeling, then I'll move on to something else. And I think that's okay. So, yeah, I think he's always just, his legacy has inspired me to just live every day and to just, being happy is an important thing. And you find things that make you happy in life.